Lauren, very simply, as you see it from the actual working hospital in Baltimore, is there finally a cresting in cases, a cresting in hospitalizations, a cresting in deaths?
I think it's a little too early to say whether it's fully a cresting or not. We are seeing a slowdown in the number of increasing cases. We haven't, I don't think, peaked that curve yet, but we are starting to see slowdowns in the volume, and all the more reason to protect those measures that are in place, like social distancing, to ensure that those volumes don't spike right back up as soon as we sort of, quote-unquote, go back to normal.
Lauren, that is certainly what I see in the fancy exponential or logarithmic charts as well, exactly as you just described it. And so much of that is done on a moving average, where professionals like you and unprofessionals like me, or even the President of the United States, have to use a number of days or weeks or months and blend it together to really see the ebb. How long is that moving average? What's the appropriate length of time for you to gauge?
Well, I think it's changing every day, and I think we're just starting to learn more information about this virus and how it behaves in people. The key is not to make an assumption way too early, right? So 2 weeks is really the minimum to even start to understand the data. You want to look at it 2 weeks out. So I think we're several months before we really can go back to or go towards planning to reopen and go back to normal.
Lauren, how quickly will we get a vaccination against the pandemic?
There's a lot of really good candidates coming up right now. I think we're seeing estimates from those scientists somewhere between 3 and 12 months, which is unbelievable for vaccine science. It's really fast, and so it's exciting to see all this progress being made. I think realistically, a vaccine that's ready to go out to the general public is about a year away, but we could start seeing candidates that could be used to protect our frontline health workers and first responders earlier, probably.
What's the biggest challenge right now? So there are a number of questions, Lauren, about, for example, asymptomatic cases, right? Why are they asymptomatic? And until you find out more about them, it's very difficult to get a handle because they keep on transmitting if the lockdown is eased somewhat. But also immunity. How close are we to understanding whether people that have had it can go back safely to work?
Yeah, there's a lot of work being done in that immunity question right now, and I think we have to, because we're so early in the outbreak, we have to wait to see how people's immune responses stay over time, and also how, when people are ready to go back to work without having symptoms. The biggest challenge right now I see is testing. We're still trying to ramp up testing in a meaningful way, and that is what every single other public health measure hinges on. All of those things that we want to use to get back to work, to alleviate social distancing, to be able to travel, to reduce the mask use, they hinge on testing.
Lauren, very quickly here, thank you so much for bringing that up. What is the constraint on getting more testing done?
I think it's a little bit of a supply issue and a lot of bit of a coordination issue. So making sure that the tests are in the right place, that people have the ability to scale up and test all the people they need to, that you continue to get the materials, and that you have the people to run the tests.